Now we see it got better here. So what of these 4 is left? Is 9 of those 4.
I'm going crazy because I'm thinking about the other numbers outside of those 4.
No. You already know down to 4. You knew this after test 2, and I think some of you are just making it harder than it is. So I'm hoping we can turn on the light today, because we still have some people struggling, and I don't want you to struggle for the final, because you know they're going to be on it. Okay, next one.
Because the PT was correct, it's not going to be, because the PTT was corrected, it's not going to be a common factor.
Okay.
So it has to be one of the PTT factors, which is 12, 11, 9, and 8. It was corrected with everything, so it has to be a common factor between the normal plasma, aged serum, and
Absorbed plasma.
absorbed plasma. Thank you. The only 2 common factors are 12 and 11. That gets rid of 9 and 8, and so it has to be 12 or 11.
Okay, so it corrected in both. So it had to be, of these 4 factors, it had to be the 2 that were in both AP and AS. 8 is not in both, 9 is not in both. So that's how they were eliminated, okay? So 11 and 12.
For ours, we had an increased PT and PTT, and it corrected with normal plasma, so we knew it was a common factor of 10, 5, 2, or 1. And then neither the plasma or serum corrected it. So in the serum, we can take off, serum didn't correct it, so cross off 10. The plasma has the 1 and 5, which didn't correct it, so cross that out, and 2 is the only factor that's left.
And see, 2 wasn't in either of these. So it didn't correct because 2 was the problem and you couldn't provide it. Normal plasma could provide it, but these 2 couldn't provide it, okay?
On this one, the PT and the PTT were both increased, so it has to be a common factor, 10, 5, 2, or 1. The PT corrected with absorbed plasma, and then it didn't correct with age serum, so it had to be either 1, 5, 8. So it's 1 or 5. Then me too, because 2 is not in.
Now, did you mistakenly say 1, 5, or 8? Because 8 wouldn't even be a choice, or
Yeah.
did you not say
Yes,
that?
Sorry.
Do you see why? Because it was a common factor, that eliminated 8.
Yeah.
And so this one, then what would be the question I could ask next is what would you do next on this one?
A fibrinogen.
Fibrinogen level. What could you do next here?
Factor assay.
Okay, so when you're down to 2 factors, they got to still continue, and even the fibrinogen is a factor assay. Okay, so I want to do those multiple correct answers questions. You will see those again. So let's put our choices up. First, we'll do the platelet ones, and we'll go around, and I'll give you a statement to each group, and you tell me what is the correct answer. Okay, the first group will have A, Bernard Soulier, B, Glanzmann thrombasthenia, C, VWF. And it was the multiple correct answers. You had to give me if it was one of them, or all 2 of them, 3 of them. Okay? So I prefer you not to look at your test. So you can. So we'll just, okay. So group, are you guys one? I'll just go around the horn. If I have an elevated bleeding time, all of them. Okay, does everybody realize if it's a platelet function disorder, it's all of them. If I have group back here, if I have an elevated PTT, yeah, because remember, VWF is the carrier of factor 8, so it can affect the PTT if 8 can't get there. So that is unique about VWF. Back here, if I said it had petechia, purpura, mucosal bleeding, what would you say? Okay, so if it's superficial bleeding, does everybody see that it's all three? If I said it was an intrinsic defect,
Is that A? Yeah, is that A? When extrinsic was glanted?
intrinsic means the platelet is defective. Extrinsic means it's something not involving the platelet because the platelet's normal. Now I'll see if you answer it.
Yeah, intrinsic.
So what is this missing? Maybe this will help. What, okay. Let's see if you can answer this. What is BS missing?
The 9 or 8? Which one's I missing? I don't remember.
Let's see if you guys know. What's Glanzman thrombasthenia missing?
GP2A.
And 3B?
Missing GP2B and GP3A. What is VWF missing?
VWF.
VWF. Now back to this group a minute. Which one or ones is the intrinsic defect?
A and B.
A and B. The platelet is defective. It's missing something. If you're missing VWF, that's from the vessel. So that would be if I asked what's the extrinsic defect?
VWF.
VWF. What would I say back there if it's sex-linked inheritance? None. What would I say then if it was autosomal? All of them. What would I say back there? It had large platelets. Bernard Soulier. What would I say? It had normal platelet size and normal amount of platelets. And what else? GT. What if I said it had a low platelet count? BS. Okay? So remember, this has a decreased platelet count. This has large platelets. This has a normal platelet count. This has normal platelet size. These two. And then what would you say normally don't treat with anything? These two normally, unless they're bleeding, you don't have to treat with anything. What would I say what would you say if I said treat with DDAVP? Then that's the VWF, okay? So remember, you're going to see those again. Okay, so let's go to the other three scenarios. So this time you have hemophilia A, hemophilia B, and then you have VWF. Now if I say, we'll start with you guys again, increased PTT.
All three.
Okay, what if I said increased bleeding time? VWF. What if I say corrects with exorplasma? Okay, because exorplasma has factor VIII. So what if I said corrects with normal H serum?
B.
Okay, hemophilia B, because it has 9. What if I say sex-linked inheritance? A and B. What if I say, then I could say treat with DDAVP, and you could say just VWF. Treat with concentrates. Which one of the three is most commonly with concentrates from a lot of sources? 8. Okay, hemophilia A. What if I say treat with prothrombin complex?
B.
B. What's in PCC?
9.
2, 7, 9, and 10. Hemophilia A most commonly is going to be from a whole pool of a lot of sources. What if I say superficial bleeding, like petechia?
C.
What if I say hemarthrosis?
A and B.
A and B. I'm trying to think what else was on that. Got the inheritance test treatment. So those you know you're going to see again. So one of your tests had those. Maybe two of the tests had them.
This is testing.
Yeah, they were on the same one. Let me see if I'm just missing anything. Because you got to know when they're. Yeah, looks like I got all of those. Yep. Okay, now let's tell me what are, so we'll start with you guys again. What are the three minor systems? Kinins. Kinins. You guys know the other two? That's the kinins. So there's two others. And protease inhibitors. Okay, so name the three kinins.
Prekallikrein,
Prekallikrein.
and the urokinase.
The H,
Oh.
the high molecular weight.
Yeah.
So what is prekallikrein? Another name? Fletcher. What's HMWK? What is the main enzyme of the kinin system? Of the three? Okay, what's the main enzyme of clotting?
No, thrombin.
Thrombin. What's the main enzyme of the fibrinolytic system? Plasmin. What are the degradation products of plasmin on fibrinogen and fibrin? Okay. What are the name three activators of plasminogen to plasmin?
TPA,
TPA,
strep or staph, and
streptokinase, staphylokinase,
and urokinase.
urokinase. What are two inhibitors of plasmin? The main one and then one from the minor system complement. And it's okay if you guys don't know. This is just to jog your memory.
No, that's
The main inhibitor, there are two inhibitors I had you know of plasmin.
I know the activators.
So alpha-2 antiplasmin and C1 esterase inhibitor. Okay? Tell me two things. Tell me another thing from complement, the minor system, that helps platelet aggregation. C5a. Okay? Tell me the protease inhibitor that works with heparin as its cofactor. The protease inhibitor that works with heparin as its cofactor. Antithrombin 3. Name the protease inhibitors that affect factors 5 and 8.
CNS.
CNS. Name, we already said alpha-2 antiplasmin. Name your key places for PF3 in the intrinsic system. Where is the only place with the PF3 in the isolated, just the intrinsic? Name the box. It's only in the intrinsic system. Not so what four things? 9A plus PF3, but what's the cofactor?
8.
Okay. So back there, tell me what is the main place with PF3 in the common factors? So back there, tell me the PTT is not corrected with normal plasma, and I'm worried about a lupus inhibitor. Why? What does it affect, and why is it nonspecific?
The lupus, it running fixed factor 8.
Nope.
10A.
Nope.
PF3.
PF3 is an anti-phospholipid antibody. So remember, what is the test you can order to confirm it that has dilute thromboplastin? It's a dilute reagent.
DRBP.
Dilute Russell Viper Venom test. So the anti-phospholipid antibody, it won't affect it greatly, okay? Which one? So it's going to be, will affect it more, it'll be prolonged. What is the one that has a high concentration of phospholipid? The PNP. And they order either one, not both. So tell me 2 hypercoagulable states that are because of a mutated factor. Factor 5 Leiden.
And prothrombin.
I'm over here, Sean. Prothrombin. Okay, so which one? Okay, you guys tell me the 3 that affect protein, factor 5 and 8 of the hypercoagulable. What deficiencies or what problems affect 5 and 8?
High levels of homocysteine.
Okay, high levels of homocysteine. Factor 5 Leiden, because it makes protein C resistance, the APCR. And then if you're deficient in what 2 things? Protein C and S. So those all affect factors 5 and 8. What does the prothrombin mutation do? Why does it cause extra clotting?
Increased PTT.
Increased levels of prothrombin, and they clot more excessively. So it's different from factor 5 Leiden. It stops protein C from doing its job. Okay? Tell me 3 differences of acute ITP from chronic ITP. Acute? So which one's child? Okay, then women, more what age?
Oh, over 50?
Well, 20 to 50. Usually they're a little bit older. Tell me which one has the worst platelet count. Okay? Tell me which one is self-limiting normal. Okay? Tell me what is the treatment of chronic usually?
Spleen or something's removed.
Well, first, but what do you try first?
Oh, steroids.
Okay, steroids, then followed by the splenectomy. And which one follows a viral infection more?
Acute.
Acute. So you guys now tell me the 5 things you need for thrombotic thrombocytopenia purpura. There's 5 symptoms you should have if you're going to call someone with TTP.
Fever.
Fever's 1. So we know fever. Neurological,
issues.
that's 2.
And, yep, I'm done.
And the other 3? Anemia, and it's usually hemolytic, so you'd have something to show hemolysis like an elevated LD or Billy or something. But
Increased BUN and LD.
okay, so BUN and creatinine,
Yeah.
and the LD goes with the hemolytic. So what is low? The platelet count. So renal problems, the BUN and creatinine, fever, neurological problems like a severe headache or migraine or something, aphasia. It has a hemolytic anemia, so low H&H, but there's something showing hemolysis. And you might see fragmented red cells on your smear because the little platelet clumps shear the red cell as they're going by, and they have a low platelet count. So you guys tell me what are 2 key features, or what is the key feature of acute and chronic ITP?
One has the antibody and the other one
Both have the antibody. That is a key common feature. Tell me, does TTP have the antibody?
No.
No. That's a big difference. ITP has the antibody, TTP doesn't. What was the thing we learned about today that has an antibody that bottoms out the platelets? HIT. So now you guys tell me, how is HUS similar to TTP?
They both have the creatinine.
Both have the high BUN and creatinine, and they, what else do they have low?
Platelets.
Platelet count. So they have blood clots with little platelet plugs. What is the key difference for HUS versus TTP? What does it follow, HUS?
Bacterial infection.
And
E.
which
coli,
two bacteria?
E. coli. and
0157 or
Shigella.
Shigella. Let me see if this class saw someone standing out here. Are you guys in here? They're in here. Okay, so anybody who wants to stay, bottom line, if you want to stay, let me give you your test if you're leaving. But if you want to stay, you're more than welcome. We'll just go to lab. If you have to leave, that's fine. You can just show up at 8 o'clock on Monday or 8 o'clock on Tuesday. And your key thing is study your test. Then after that, look over your study guides and your PowerPoints. But your tests are going to be your key things. Okay? And does someone have, oh, here's the paper with that.
I didn't get it either.
Well, here's the sheet right here. Because I want you to be able to take all your tests.
What kind of your pen?
Here you go. And please, if someone is still struggling, I don't mind working at
Are you
all.
staying?
I don't know why I bother putting it in alphabetical order because I still walk around the room. I don't mind working with some of you or anybody who wants to continue. We'll just go over to the lab.
You have a ton of papers.
No, I just put them, I try to put them in alphabetical order, but when you come to class, no one's sitting in alphabetical order, so I don't know why I bother. But it is easier for putting them. So remember, this one will just, test 6 will only have, here you go, Leah.